Hello everyone, welcome to Aanvii Hearing. Today I'm going to talk about how to manage the noise in your ears, the various tinnitus treatments. Tinnitus, the perception of noise in your ears without an external source, affects millions of people. These sounds can range from ringing to buzzing, hissing, or music. Whether it's temporary or persistent, tinnitus can be challenging. In this podcast, we'll explore various treatments to help manage tinnitus, providing individuals with better control over their lives. Understanding tinnitus. Before discussing treatments, let's understand the causes and mechanisms. Tinnitus isn't a standalone issue but a symptom of an underlying condition. It can result from exposure to loud noise, age related hearing loss, earwax blockage, medical conditions, medications, injuries, or stress. Tinnitus is believed to arise from auditory, neurological, and psychological factors. Auditory system dysfunction. Damage to the inner ear or auditory nerve can make the brain interpret silence as a signal to create noise, resulting in tinnitus. Neurological changes. Alterations in brain networks can contribute to tinnitus, potentially stemming from hearing loss or other factors causing abnormal neural activity. Phantom sound perception. The brain's response to a lack of external stimuli can lead to the perception of phantom sounds. When the brain receives insufficient input from the auditory system, it generates signals perceived as sound. Psychological factors. The emotional impact of tinnitus is significant. Anxiety, depression, and stress can worsen tinnitus and influence its perception. Treatments for tinnitus. Tinnitus treatments vary based on an individual's circumstances and underlying causes. Here are some commonly used approaches. Hearing aids. For tinnitus related to hearing loss, hearing aids are valuable. They amplify external sounds, making it easier to hear and helping mask tinnitus. Improved overall hearing often reduces tinnitus perception. Sound therapy. External sounds are used in sound therapy to cover or distract from tinnitus. Wearable sound generators. Small discrete devices worn like hearing aids provide continuous sound that distracts from tinnitus. Smartphone apps. Numerous apps offer customizable sounds for sound therapy, letting users choose the most effective sounds. Counseling and cognitive behavioral therapy (CBT). CBT helps individuals manage tinnitus's emotional and psychological aspects, changing negative thought patterns and reactions. Medications. Medications may be prescribed to alleviate tinnitus, especially when linked to medical conditions or anxiety. Medications may include tricyclic antidepressants, effective for some in reducing tinnitus symptoms. Anti-seizure medications. These may be used to control neural activity associated with tinnitus. Tinnitus retraining therapy (TRT). TRT combines counseling and sound therapy to help individuals become accustomed to their tinnitus, making it less intrusive over time. Lifestyle modifications. Certain changes can help manage tinnitus, limiting loud noises. Protect your ears from damage by avoiding loud environments and using hearing protection when necessary. Reducing caffeine and alcohol intake. Excessive consumption can worsen tinnitus for some individuals, so moderation helps. Quitting smoking. Smoking is linked to an increased risk of tinnitus. Quitting can alleviate symptoms. Experimental treatments. Some experimental treatments include transcranial magnetic stimulation (TMS). Uses magnetic fields to stimulate specific brain regions, showing promising results in reducing tinnitus. Electrodes implanted in the brain, investigated for severe tinnitus cases. Alternative therapies. While evidence is limited, some report relief from tinnitus through methods like acupuncture, ginkgo biloba supplements, or homeopathic remedies. Consult a healthcare professional before pursuing these approaches. Mindfulness and stress reduction. Practices like mindfulness, meditation, and stress reduction techniques help manage tinnitus emotionally. Reducing stress and anxiety can lessen the perceived intensity of tinnitus. Tinnitus is a complex condition with diverse causes and mechanisms. Although there's no universal cure, various treatments and strategies help manage its symptoms. Effective management combines different approaches tailored to individual needs. Understanding what creates the perception of noise in the ears and exploring treatment options is essential. If you or someone you know experiences tinnitus, consult a healthcare professional to determine the best treatment plan. For more information, visit our website, which is www.aanvihearing.com, or call us on 9658395839.